In this video, I will be discussing what to expect on your PTCB exam and what are the knowledge domains you will be tested on when you sit for your pharmacy tech exam. So buckle up and be ready to take notes. Hey my future pharmacy technicians, welcome to my channel Pharmacy Tech Study Guide. I'm Sidra, pharmacist by profession and passionate about guiding you become an excellent pharmacy technician. Well, being a pharmacist and pharmacy manager in one of the biggest retails in US, I can tell you this, that I consider pharmacy techs as an asset and a backbone of pharmacy. A pharmacy or a pharmacist cannot function properly without you guys. So I think training and educating pharmacy techs is like a professional investment for me. If you want a promising career as a pharmacy tech and need to prepare for it, then come along, you're on the right place here with me. Alright, coming back to the topic of this video, what to expect on your pharmacy tech exam, which is PTCE. This is a computer-based exam that you can take within 60 days of completing PTCB recognized education or training program. Or if you submit a proof of working at least 500 hours in a pharmacy, that still meets the eligibility criteria to sit for an exam. Now, I've discussed all these requirements and the process of scheduling your PTCB exam in a separate video. Check that out. I'll put the link for you in the I button, also in the description. In this video, we're not going to talk about it. We're going to focus on what to expect on the exam and the content outline for the exam. So the exam is a multiple choice question. It contains 90 questions, out of which 80 are scored and 10 are unscored. Each question lists 4 possible answers and only one of which is correct or the best possible answer. Unscored questions are not identified, of course, and are randomly distributed throughout the exam, and your score is based on the response to the 80 scored questions. Now, be prepared to commit 2 hours for the exam, 5 minutes tutorial in the intro, and kind of 5 minutes post-exam survey. So that being said, you get 1 hour 50 minutes to complete 90 questions, which gives you roughly 22 seconds to answer each question. So with such a limited time, I think it's really important that you get good grip of your study material. PTCB has given the exam content online on their website, which is ptcb.org. I highly recommend that you do check it out, read it at least once so you kind of get an idea. You can see the link to the content outline on the screen, and for your convenience, I'll also put the link in the description. So basically, the PTCB exam will test your knowledge in 4 different areas, officially called knowledge domains. Now let's take a deeper look at what you can expect from each knowledge domain and how much they'll contribute to your total score. So 40% of exam covers medications, 12.5% covers federal requirements, so that's your law portion, 26.25% of the exam is on patient safety and quality assurance, and 21.25% of your exam is on order or prescription entry and processing. Let's talk about medications. So as a pharmacy technician, dispensing medications is one of the most vital part of your job. Whether you're at out window selling prescriptions or at the back of the pharmacy typing and counting pills, you will be dealing with medications day in and day out. So make sure you know your medications. You should know the brand and generic names, what's the medication for, the storage conditions of the medications, should you put it on the shelf or should you put it in the refrigerator. Also the strength of the medication, what dosage forms the medication comes in, whether it's in a tablet form, suppository form, liquid form. You should also expect questions in your exam about medication interactions and contraindications, whether the medication is okay to use in certain diseases, or will certain other medications or supplements patient is taking will interact with the medication. Now, I understand this sounds a lot and it's very intimidating. Well, you're not expected to know all of this in depth because at pharmacy, you can't really answer any medication related questions to patients. You have to basically refer those questions to the pharmacist. But in order to refer patients to the pharmacist, you must be able to understand what the patient is asking for and be able to understand when to refer patient to the pharmacist. See, as a pharmacy technician, you may be working at the out window where patients are picking up not just the new prescriptions, but also refills. And pharmacists are basically at the back. We don't really get to interact with every single patient, especially when patient is just picking up a refill or buying an over-the-counter medication medications. So at that instance, you have to have enough knowledge to identify any possible interaction or problem and refer the patient to the pharmacist. Well, let me explain this better with an example. Let's assume a scenario that Mr. Smith, who's a regular customer of your pharmacy, comes to pharmacy counter and picks up a refill of, let's say, his blood pressure medication and heart medication. And at the pharmacy counter, he asks you to sell Sidra to him, which is an over-the-counter medication that he would like for his congestion. Now, at this point, as a pharmacy technician, if you have the knowledge of medication interaction, then you'll be able to realize that Sidra is not recommended to high blood pressure patient and heart patients. So you will be able to refer Mr. Smith to the pharmacist who can further educate him about this interaction and suggest him some other medication for his congestion. See, this is how important your role is as a pharmacy technician. Like, you just recognized a possible interaction at the out window and saved Mr. Smith. Alright, now that you get the idea why having medication knowledge is important, the next question you might have is which medications to focus on, because there are just so many different medications in pharmacy. Well, I would say it would be really nice if you study the top 200, but if not, that's okay. I really want you to focus on the top 100 medications. And I certainly don't recommend that you sit down one day and try to cram and remember all those 100 medications all at once. No, it doesn't work. You won't be able to retain anything at all. I recommend categorizing your medications by health conditions they treat. Like, for example, categorize the cardiovascular medications, thyroid medications, diabetes medications, and so on and so forth. Now, memorize no more than one drug category per day. Repeat what you memorize, and if you work in a pharmacy, which I highly recommend that you do if you're trying to pass your PTCB exam, because that would give you a practical understanding of what you learn. You'll be able to relate what you have learned to the everyday workflow. That would help you understand things and retain medications and drug information way better. In the exam, you will be asked questions about the laws and regulations. It covers about 12.5% of the exam, but is very important from practical point of view. When you're working in pharmacy as a licensed pharmacy technician, you must always follow the law. No matter whatever the circumstances may be, no one is ever above the law. Because if you don't follow the laws, you are going to risk not only your license, but also the license of your pharmacist you're working with, and you don't want that to happen, right? Some of the things that you should know around the pharmacy laws are how to handle hazardous and non-hazardous medications. You should know what to do in case you drop a pill or you have a broken pill. You should know laws around the control medications, like what are the requirements of Schedule 2 and Schedule 3 to 5 medications, how many refills can they have, how can you transfer them, or whether you can transfer them or not. You should also know the laws on how to handle recalled drugs or drugs in restricted medication program, like your clozapine or your isotretinoin. These are the REMS drugs. Another important thing that you should know around laws is how to handle theft or any loss of medication. Now, I will be discussing all of these laws and regulations in my videos, so be sure you subscribe to my channel and hit that notification icon so you don't miss any of my lessons. When you're working in pharmacy, it's all about patient safety and quality. You should know not only how to identify errors, but also how to prevent them from happening and what to do should there be a medication error. That's why it's important that you know your look-alike, sound-alike medications. These are the medications which are visually similar in physical appearance or packaging. So you should always be more cautious when dealing with these medications because there are more chances of making errors when handling them. For example, prednisone and prednisolone, they both kind of sound alike, so you should know how to differentiate them. And like I said before, you have to be extra careful with such medications because such medications result in more common medication errors. So for this portion of the exam, you should also have understanding and knowledge of the strategies used to prevent such errors, like tall man lettering. You should know how you can separate look-alike, sound-alike drugs in the inventory. You should learn how to use the leading and trailing zero. I do want to point out one thing, that of course we cannot completely eliminate the human error factor in pharmacy. So the goal is to catch the medication error within the pharmacy before it reaches to the patient. But Unfortunately, if the error does get unnoticed and reaches to patient, then you must know how to report that error. In exam, you will be asked questions on the types of prescription errors like abnormal dosing, early fill, incorrect quantity, incorrect patient, incorrect medication. So make sure you understand all of that. The patient safety also includes pharmacy hygiene. So you must also know all the standard cleaning and hygiene procedures, and that not only involves patient safety, but that also includes your personal safety. Now, in the exam, you will be asked questions on prescription entry and processing. This is very, very important. For this section, you must get a good understanding of math. And in math, you should know dose conversion, formulas, day supply calculation, flow rate, what else? Ratios and proportions, alligation method, dosage and quantity calculations. Basically, you need to know everything that would be required when filling a prescription. That also includes interpreting and reading doctor's scribble on the prescription. And in order to understand that, you need to know your medical abbreviations and SIG codes. You must know what lot numbers and NDCs of the medications refer to, how to reconstitute and compound both sterile and non-sterile medications. And last but not the least, you must also know the procedures of what to do when a patient returns a medication, how to return to stock the medication that has never left the pharmacy. Also, you should know how to order the medication and how to reverse distribute the medication. Well, I know there's a lot to learn, but at least now you know what to focus on and what to expect on the exam. I hope this video is helpful for you. If you have any questions and topic suggestions, leave them in the comments, and be sure to subscribe so you don't miss any of the Pharmacy Tech Study Guide lessons. Thank you so much for watching. I'll see you in the next lesson.